I think about them as a not-so-friendly game of musical chairs, where seemingly every time the music stops, we find that African Americans, people of African descent, black people, are always the ones left standing. When we look at different health outcomes, every time the music stops, black patients are left standing, right? We look at infant mortality, we look at life expectancy. We try to understand it in the realm of even instances or incidences of disease. Black people are left standing. So we go through this process. I think Paul Herbert said it best with his colleagues in this paper, where they asked this fundamental question: when does difference become disparity? Because a lot of people try and attribute this question of health differences versus health disparity. And what we find is that differences are basically denoted as clinical appropriate care, right? So 100 people come in, a doc does 100 things, he does it the same way, and no matter what happens, the differences are the differences are the differences, right? And then the second part of the differences are patient preferences, patient lifestyle. So some people don't want chemotherapy. Some people wouldn't prefer this drug or this treatment. While when we look at the concept of disparity within itself, disparity is talking more about a legal or regulatory environment that can sustain disparity. Legal or regulatory. And then we have provider discrimination under the framework of disparity. So we try and ask this question, and again, I go back to the game of musical chairs. Because I think a lot of people would argue in this health disparities world that as folks are circling the chair, waiting on that little bit of music to stop, our argument and policymakers have said, look, we need more chairs. We need more access. We need more things, right? We need more funding. We need more research. We need better quality. But at the end of the day, I would argue that we need to change the DJ. I would argue that part of the problem has been the regulatory environment that has been able to escape true scrutiny, and that is the law. So I decided to focus just on one of the proposed solutions to health disparity, because I don't have a lot of time. So my issue is going to be the law for the sake of this few minutes that I have. And when we look at the law legislates action, but not attitude. Right? We can tell people, look, you can't refuse service. You can't just flat out treat somebody differently and things will be okay. We can't do that. But it still doesn't change the attitudes of many of our providers. The next thing that we look at, it tackles law, that is, it tackles the overt instances of discrimination. It tackles the extreme cases where we had one young lady, she sued her doc. She was going in, she said that her physician was racist. He divided his weight rooms. He had black weight room and white weight rooms. He went in, and next thing you know, he tells her that she has cancer. And as he tells her that she has cancer, the first thing that happens is he said, I got to do an emergency surgery. He does a mastectomy. He removes her breast. And then they do a biopsy and find out she never had cancer. She sued. At any rate, we could see that obviously this should be nothing more than just a negligence issue, potentially. But she went in under the charge of racial discrimination, and she lost her case because the law is not framed really to deal with racism, particularly in healthcare. The legal contradictions. I know you know a little bit about the 14th Amendment. It tried to grant the right of citizenship. And the 15th Amendment said, okay, we know we told you were citizens, but now you can vote. And then you push the fast forward button and you go through time and through the evolution of the rise of the KKK, and you see the rise of Jim Crow, and then you go through the Civil Rights Movement nearly 100 years later. We know we told you that on the 14th Amendment that you all are citizens, but now we really mean it with the Civil Rights Movement, with the Civil Rights Act of 1964. Oh my gracious, how did I forget again? We know we told you you could vote with the 15th Amendment, but now I really mean it with the Voter Registration Act of 1965. We have so many legal contradictions. Medical profiling is something that is in essence really ingrained and inherent in our system. It's in our system. Renee Bowser says that the medical profession's academic disciplines and medical practices reproduce legitimate biological and ideological mythologies about black patients. Our medical schools are teaching it. Our hospitals are truly believing it. And then next thing you know, we have a disparity. So I close with some would believe it's a bad slide, but I had to do this. I went to the archives. I'm a history. I got my bachelor's and master's in history. And I went through and I found this wait list, or this patient log of Dr. James Herron. He was a physician in Pensacola in 1872. And I put an arrow there because I wanted to show you something. The patients that came to see him during the heart of the yellow fever outbreak, they would come into this place and they would have a name. This is Woods. You see Mr. Baker. But then when a black patient came in, they just simply put Negro. They had no name. George Zimmerman killed Trayvon Martin. He killed a black, suspicious punk that had no name. He had no name. When we think about our system, many of the disparities that we fight, many of the people, the policies, the solutions, we're fighting solutions, and these people that come up with all of these great laws, look at the folks they're trying to help as if they have no name. When you think about this concept of post-racial society, we're at a stage where now everybody wants to stand up and say we're beyond race, but I would argue that unfortunately being beyond race is not true. We have been beyond this point, and I think the biggest factor in this is that the situation hasn't changed, just the urgency to change the situation has changed. So every time we've slowed down and we're less urgent in education, somebody without a name is lost. Every time we're less urgent in regards to the legal environment and the legal framework and law enforcement, a young black man is lost with no name. In healthcare, every time somebody creates something, they're looking at them as if they have no name. And I can say as a cancer researcher and as someone who is an activist for health equity that my name is Kevin Jenkins. What is your name? Thank you.